So let's talk about Little League elbow. First things first, what is Little League elbow? And probably most important here, this is always a doctor referral. So anytime we get into growth plate or bone or actual structural issues, always go see a doctor. Okay, they're going to be able to do the x-rays, the MRIs, whatever it may be to determine actually what's going on inside. Because everything pathological or anything like that we do in the training aspect, we can't really work around structural issues. So the structural issues have to be determined first, fixed, or allowed to heal, that sort of thing. So always refer to a doctor first. But what is Little League elbow? Well, Little League elbow is simply, look, a young athlete is maturing and growing. By doing so, they're forming new bone material. The bones are getting larger, longer, all that sort of thing. And as they go through this phase, they're more susceptible to some injuries, specifically when it comes to the growth plate issues, because the growth plate is opening up, allowing for more bone formation. And in doing so, the bone is kind of at its weakest point there because it's not fully mature yet. So high intensity, stressful situations like throwing a baseball can sometimes put extra stress on those growth plates, especially in specific areas. In baseball players and pitchers, more than likely, it's usually the medial elbow portion. Sometimes it's lateral elbow as well. Sometimes it's shoulder, but those are the more common areas. So again, this is as a young athlete develops, and so that's why it's even more important to go to a doctor first. You want to know if that growth plate is really wide open and they're like about to go through a rapid growth spurt, or maybe they're already going through a rapid growth spurt. And in that case, it goes to the next point here where rest. Rest might be a good idea, especially if the growth plates are completely wide open and they're about to shoot up, because really trying to manage stress during that period is really, really difficult. And the other thing is too, this shouldn't be a really long lasting thing. You're talking about 6-8 weeks, maybe a few months or something like that, where the growth spurt happens, new bones form, and then you can go back to actually stressing the athlete a little bit. So the important thing is sometimes rest is needed. The other popular thing that people do is they talk about ice. Anytime there's pain, they like to use ice, blah, blah, blah. Well, I'm not going to say ice is debunked, right? Like, it does control inflammation. If you have an acute injury, like you roll your ankle or something like that, ice may be appropriate at that time to control the swelling and control the inflammation that's actually there. What actually goes on whenever you pitch, though, is you cause micro trauma in the area, whether it be the shoulder or the elbow. And that micro trauma does send signals to the body to increase inflammation, because that's the body's first response in healing an injury. Whenever we put ice on there, all we're doing is we're slowing down that recovery process. So we want that recovery process to happen naturally, or we want to kind of give it a little boost and maybe get it kickstarted a little bit with some of the other things that we're going to talk about with arm care. But really, if there's nothing structurally wrong, and if an acute injury didn't happen, ice is really probably not needed. Next thing is arm care. I put quotes around arm care because it's really kind of this term that just gets thrown around all over the place. What do I consider arm care? Arm care is anything to do with the body that gets the body ready or prepared for the sport. So that's my simple definition. Yes, that is really vague, and yes, that is all encompassing, but sometimes ankle mobility can cause issues up the chain, whether it be elbow or shoulder. And so sometimes an ankle mobility exercise is considered arm care, in my opinion. Now, let's say that you got doctor's clearance, everything's good there, he doesn't need rest. So now you can start actually progressively stressing the athlete. In doing so, you really want to make sure that the athlete is fully warmed up, and not just in the shoulder area, but again, full body. So a full dynamic warm up is good. I love agility hurdles and ladders. Reason being, it's fun, it gets the athletes moving fast, and it warms their whole body up. I think it's one of the most underrated exercises It's something that I did when I was really, really young, and I think that really helped my development process. So more specific stuff, you get into more of maybe like the shoulder tube. So the shoulder tube here is a great tool because it's very general, it's very gradual. The athlete can just put a minimal amount of stress into it and they start getting the flow of it. And so then they can actually build up to where they're actually exerting a lot more force into it. The problem that I see with a lot of other tools out there is they're too stressful right off the bat. So if you have to really get this thing going, it's probably not the right approach. You just want to be able to just gradually start moving the ends, start going through some full ranges of motion. You're waking up your arm, your shoulder, and your whole shoulder complex really. So that's why I like the shoulder tube. It's very gradual, it's very general, so it's not extremely targeted, and it's not something that is very stressful right off the bat. The next thing is we have what we call a SupiPro. You've probably seen the exercises done in physical therapy where you're going into supination and pronation. Ours is basically a rod that has a cylinder on the end that you can basically change the weight through leverage weight. So you roll the cylinder down if you want to make it lighter, and then you roll it up towards the end of the cylinder to make it heavier. So it's really easy to change, especially an individual at home. You know, they don't have to buy 6 or 7 dumbbells or some other items there. They can just buy one and be done with it. The next thing is the baseball training sock. When bringing an athlete back from, not necessarily an injury, but bringing back an athlete, period, after a period of time where they're not throwing, I think the sock is extremely beneficial. And the reason is they don't need a throwing partner. They can throw indoors. And whenever they throw indoors, you're always going to be throwing sub-maximally, which is good, especially whenever you're getting an athlete reintroduced to the stresses of throwing. So I have a 7-ounce ball in here. I do like the 7-ounce. The 7-ounce actually kind of helps you throw in the sock a little bit better. And then also too, it's a little less stressful than throwing an actual baseball. So I put the 7-ounce in here, I put the sock on, and then I'll just cinch it up really tight around my wrist. And what this does, again, is it allows you to actually throw while throwing indoors or while throwing without a partner. And again, we're just gradually reintroducing the stress of the athlete to actually throwing. The other beautiful thing about it is you can control more of the volume as well. So if you want the athlete to maybe make 15 throws today or 20 throws today, it's a lot easier to count with this than it is when you're out there playing catch and you got little Johnny sitting there saying, "One more, coach, one more, dad, you know, let me fire it in." So it just makes it a little bit easier from that aspect. Next, everybody has seen tubing exercises. That's great, especially full body tubing, which we really promote. But tubing in general is great. Again, just activating the musculature in the arms and shoulders, and also strengthening that area as well. The only thing that I would advise is really look into sheath tubing. That's what we sell. And the reason we like the sheath tubing is if something happens to the band and it comes back and snaps, it snaps in the sheath, so it protects the athlete. That's why we call it a safety tubing. It's just really safe. It's a safe alternative to just regular tubing. Next, once you kind of get the athlete acclimated to the stress and getting their body warmed up and ready to throw, then you get into the actual throwing. This is where you get into mechanical efficiency. This is where I underlined instructor. Look, I'm not going to say one instructor is better than the other. I think you need to find an instructor that works well with you and works well with your son or your athlete, and helps them create mechanical efficiency or arm action or movement patterns that are beneficial to them. So that's why I say go and look for an instructor that suits you well. Find one in your area, find one remotely, whatever you got to do to make sure that the instructor is benefiting your child and creating their own mechanical efficient path. One thing I will say on here especially, and it kind of goes to the tools, if anyone tells you that you need to use the tool every single day or every single time you pitch, you might want to run, okay? The other thing that I would say run from is if an instructor or anybody says there is one way you should throw, also run. Look, everybody is their own person, they're individualized, they have their own needs, they move completely different ways. So one way of throwing is not superior to another. It just depends on the person and what is mechanically efficient for them. The other thing is with all of these tools, look, some of them are great warm-up tools, some of them are great throwing tools. We have tools that actually help with mechanical efficiency. The one thing that we'll always say is you should never have one of these tools as a crutch. So you should never have to use every single one of these tools or one of these tools every single time you throw or pick up a ball or whatever. You know, the shoulder tube is amazing. I love it. I would personally use the shoulder tube before I would throw. But if I was in a bind and I had 5 minutes to warm up, and maybe I didn't have my shoulder tube, there is no excuse that I have to have my shoulder tube that day in order to get a good warm-up in. I can do that with some other items. I can do it through some other exercises, whatever. So if there's ever a tool that people say you have to use every time you throw, I don't know about that. Same thing with mechanical efficiency. If there's saying there's one ideal way of throwing, yeah, probably not. Last thing is progressive stress tolerance. So anytime you're bringing an athlete back from just an extended period off or whatever, you want to incrementally increase the stress level, whether it be the throwing volume or the throwing intensity, or whether it be the actual just moving of it. So a lot of times people like to cycle this, which is fine. So some days you'll have a little bit higher, and then you go into a lower, and then a moderate day, and then you'll get back into a higher day, so that you can kind of stress that body just enough to see some growth, but not enough to really, inhibit the growth or maybe cause injury there. So I call it progressive because it's not necessarily like I'm going to make 10 throws today, 11 throws tomorrow, 12 throws the next, that sort of thing. It's not progressive in that nature. Again, it's really beneficial to cycle, but over time, like a 6 to 8 week or 12-week period, you still want to see that volume uptick ever so slightly. So it may not be a perfect linear graph here, but you'll see some uphills, but slowly you'll start to see it climb up so that they'll be able to handle more workload at a higher intensity. So make sure you're doing that very slowly, progressively, and then also, really question the athlete as well. How do you feel today? Good. All right, we can push it a little bit. How do you feel? Not so good. Well, pull it back, have a light day that day, and see what he feels like tomorrow. Again, you're looking at a long-term goal here. You're not looking to have your kid ready in 3 weeks to go for a showcase or something. Like, you've got to start thinking about their long-term play and their long-term health. And in doing so, that may take 8, 12 weeks. It may take 16 weeks. It may take 20 weeks just to get the athlete acclimated to the stress that they need. So I hope this helps. I know it's really long-winded, but there's a lot that goes on to this. You can't just start implementing or throwing in a couple of things and thinking that's going to solve everything. The body is very complex and it's holistic. So you need to have a holistic approach.